And so we as an organization, we exist to help them make a difference in the lives of children who are living in those dangerous environments.
Every single one of us is a leader and could be a leader.
It started with a local coalition in our county.
Strategies you know, but stories you don't.
Data is the currency of prevention.
We want to reduce the negative, and we want to promote the positive.
Collaboration is the only way to move the prevention needle.
About connecting the research with the practitioner.
Put something out there that was kind of off the wall and create a community of prevention.
It's a passion, it's a real love to try to help make our world a little bit better, a little bit happier, small pieces at a time.
It's said an overnight success takes 16 years.
If we didn't plan for the change, but if we didn't help orchestrate it, then change is going to be upon us.
When it comes to the spiff, slow is smooth, and smooth is fast. Because the real power is in the process.
Ultimately, all of us want success in the work we're doing. We don't want to do mindless work. Proactive, participatory planning promotes positive, preventive progress.
This is the Mid-America PTTC podcast. I'm your host, Dave Clausen, and I'm the director of the Mid-America Prevention Technology Transfer Center. This is episode 33, and today we'll be talking with Scott Henderson. Scott is the new executive director for the National Alliance for Drug Endangered Children. He's got a rich history within our Mid-America region, and he's spent many, many years working with at-risk youth. Now, as you may know, we have a wonderful partnership with the National Alliance for Drug Endangered Children. And currently in our region, we're collaborating on the Drug Endangered Children's Development Academy. Now that's coaching 7 different communities from across the state of Kansas through launching their own local DEC alliance. We've also been making the rounds through the region, building awareness, fostering partnerships, and supporting local DEC development. In today's episode, Scott's going to share some of his background and the background on the National Alliance for Drug Endangered Children. He's also going to give us some exciting news about their work. They've got a lot going on. Everything from free online training to developing a smartphone app that will help communities support drug endangered children. But before we get into the content, we'd like to thank our funder, the Substance Abuse and Mental Health Services Administration. And a quick note, although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Without further ado, let's get into the episode. All right, and I would like to welcome Scott Henderson to the podcast. Scott, thanks for joining us.
Thanks, Dave. It's great to be with you.
Yeah, I've been looking forward to recording this episode for some time now. I'd like to get things started off with just a little bit about sort of your background. I understand you've got some ties to our Mid-America region.
I do. I was born in Iowa. Our family lived in northern Kansas for a while. We took a little hiatus to Scotland, where we lived for 3.5 years. My dad was working on his PhD, so we got to be little Scottish boys for a while. But when we came back, we settled in Kansas City. So KC is really where I went through, the end of elementary school, junior high, high school, and college.
Hey, all right, those Mid-America ties. I knew I liked you for a reason. So as I was sort of prepping for this episode, looking at your bio, you've got a long, rich history of working with youth, and I just found it fascinating and want to know more. What'd you do?
Yeah, so I've got about 20 years of experience as a nonprofit executive director, and almost all of that time has been working with youth. It's youth in all walks of life, from all backgrounds, but specifically what my focus was working with youth that were at risk. And so we've done an awful lot of programs that were educational, experiential, some residential, reaching out to kids that were at youth or at risk. So we've done a little bit of everything over the years, specifically worked with kids whose parents have been affected by incarceration or some kind of substance abuse. Now they're reunited with those parents, and as part of kind of a life skills for both parents and the kids, we ran a residential program where they would live at our site We had a large retreat and conference center, and they would live at our site for a period of months. And different professionals from the community would come in and help them understand what it was to budget their finances. We'd have nutritionists that came in and said, here's how you prepare nutritious, cost-effective meals for your family. We had counselors that came in and helped the kids and the parents kind of unpack that experience and come together as a family again. And gosh, an awful lot of those programs have really been transformational for those that were the participants, but especially for us as a staff, to see the hope and redemption that can be there when there's a focused effort and an intentional effort to bring the family together.
With a little bit of hope, sprinkle in some intentional effort, you can really create some positive change in people's lives. I love it.
That was actually the genesis for that program, was a conversation with a mom who was expressing no hope, and she just didn't see a future. And so we invited her to come out, and actually we initially invited her to come work at our site, and we were going to provide housing for her. And that became the springboard for the whole program. So a simple conversation and offering hope turned into something that was transformational.
I'm going to stop myself from going off on a soapbox, but yes, conversations are so powerful and they really can change lives. I love it. Now, you kind of hinted at 20 years of experience with the nonprofits. It's my understanding that it was really focused around collaboration and change management. But what does that mean?
So we were, for most of the time, I was working for organizations that provided housing and programs. And we also provided a place for others to come and lead their program. And so what that requires is collaboration, understanding what their program is, knowing how best to be a resource and a support for that program, and then offering them options that can make that program better. So those collaborations became very meaningful because we reached a huge population that way that we couldn't have reached on our own. We gave them an anchor point for their program because of the collaboration. And then that in turn affected a huge population. One of the really fun programs that we did was a summer program for children and youth that had either been born without a limb or had lost a limb. And they didn't have their own facility, but they had their own program. And so we provided the residential facility for that program. And my favorite experience, I have a background in aquatics. I was a lifeguard and aquatics manager in my younger days. And I would always go to the pool with them when it was pool time during the summer months. And at the end of the 2 weeks that they had at our site, they said their favorite experience was the swimming pool, because it's the only time they could go swimming and everybody was just like them. They didn't stand out. They didn't feel self-conscious. So simple things that we take for granted that became a program element that was meaningful to the participants. Those collaborations really led to an awful lot of those.
I'm just picturing in my mind now just the smiles and just the pure, unbridled joy that those kids had to have been experiencing. It just kind of makes you tingle a little bit. I love it. Very powerful, very powerful. And relating directly to prevention work, collaboration, we say it all the time, is the only way to move the prevention needle. And that's where it's at, because together we're stronger and prevention is better together. I like it. Now, for me, I can see how your rich history of working with at-risk youth and collaboration has led you to your current position as the Executive Director for the National Alliance for Drug Endangered Children. But I know some of our listeners might not be familiar with National DEC for short. Would you give us just kind of a quick overview? What is National DEC and kind of what's your mission?
Sure. So National DEC was started and established in 2003 in response to children that were being affected and impacted by substance abuse by parents and caregivers. And so we as an organization, we exist to help them make a difference in the lives of children who are living in those dangerous environments. So we believe the best way to address that is a coordinated response. So we really do advocate a multidisciplinary approach, a collaboration, if you will. That really puts the kids' needs first. It's focused around early identification, early intervention, and then again, putting the kids' needs first to do something tangible to meet their needs. And that can change the course of the direction of their lives permanently.
During our last webinar that actually your trainers, Stacy and Eric, did, they really drove home that it's never too early to intervene. And it's also never too late to intervene. We just let our audience sit with that because it's so true. It's so true. You really can change the trajectory of a child's life.
And it's where we all can play a role. We can all be a part of that early identification and intervention for the children. So we really do kind of anchor ourselves around rescue, defend, shelter, and support. Those are some key words around our organization. And so while we're the national alliance, another key component of what we do is we are a support and a collaborator, and we provide a variety of resources for the state and local alliances across the country. And we do that in a number of different ways, partly through technical assistance, partly through participating in panel discussions, some additional training, providing a lot of resources, and especially during this time where we've all been physically distanced and socially distanced, providing some one-page documents about what to look for if you're on a Zoom call, how to react, how to respond. If you do learn about something in this new environment that we've been in. So we really do try to be an organization that is open to change, that's responsive to the needs of those that we're seeking to serve.
And I would second that. You absolutely are. Quick little shout out to our folks in Kansas. We currently have the DEC Development Academy going on with 7 different teams from the state of Kansas, all across the state, that are going through our academy that we are delivering in partnership with National DEC. And soon hope to have 7 new local DEC alliances across the state of Kansas, helping support and change the lives of drug endangered children in Kansas. All right, so that's just a little shout out for them because they've been working hard and they're doing great stuff. I've heard sort of hints and tidbits about some fun, exciting projects that National DEC has coming up. Is there anything you're able to share with us right now about what we have to look forward to?
Sure. So I've got a couple previews that I can share. We have done an online training program for the COPS office that has really received an amazing response. We were prepared for success, but I'm not sure we were prepared for this much success. But in 6 weeks, almost 1,200 people have participated and completed the training. So it's really been impactful. So we're going to use that as a springboard, and we're working on developing a national DEC learning management system that will provide a variety of training across all disciplines. Some of it will be even training that will provide continuing education credits. Some of it will be very practical. One of the things that we've identified, and this probably comes out of my background, is I was a mandatory reporter because we worked with 11 to 12,000 youth every year at our facility. My insurance company required me to be a mandatory reporter, but nobody could tell me how to be a mandatory reporter. So we're developing some mandatory reporter training that will be specific to the requirements of all 50 states and also meet insuring agency requirements. So that's one of the practical pieces. So this learning management system will be very robust, it'll be responsive, and it'll be available to everybody in all disciplines and all alliances.
Oh, man. I like it. I like it. I want to throw in real quick, too. Sort of coming from my background, having been prior law enforcement, both in the correctional setting and actual law enforcement patrol setting, the mandatory reporter aspect and really understanding the definition of neglect as child welfare sees it, I can't remember ever really being briefed or trained on that aspect other than you're a mandatory reporter. So I'm looking forward to that training coming out. That'll be great stuff and really fill that gap.
Yeah, I'll never forget after our first risk management audit, I was being briefed by our auditor about our requirement to be a mandatory reporter. And I said, great, I'm assuming you guys provide that training. And he said, oh, no, that's not what we do. You have to go out and find it. And I looked for probably 6 months to find a source that could provide real training for myself and the rest of our staff, and I couldn't. And so we did the best we could to develop our own policies and procedures for that we did send to the insurance company, and they never really responded to that. I'm not sure, if they were equipped for that or if they just receiving it as a point of information. But we recognize that folks want to do a really good job and be a good collaborator and work effectively with social services. But to do that, you do need some training to do that. So we're going to develop that training to help folks.
Well, when that's ready to roll out, let me know, because that'll be another podcast episode we're going to put together. Help get that out there. I like it. And you had started to share about a second little preview you've got for us. What was that one?
So we're trying to use all the tools that are at all of our disposal. And so we've received a grant to begin to develop a national DEC mobile application that will be available nationally to everybody again in every discipline. So we're working on phase one, which will be support for those that are affected by substance abuse all across the country, providing resources to them that are specific to the area where they live. So we're currently in development of that part of the mobile application. And then we do have an application in to finish the mobile application, which will provide resources for the state and local alliances, information, resources for them. The third piece of that will be a connection and a continuation of our online training. So you'll be able to get online training via our mobile app. So short little training pieces that can build knowledge and build collaboration. And then the fourth component will be a way for the alliances to have an internal communication device. So it's a peer-to-peer communication piece that allows you to share information within your local or state alliance very easily. And then we can also push information if there's something really pertinent that we feel like it's important for you to have access to right away. So it'll really be a comprehensive mobile application that functions nationwide, that gives access to information specific to your local area.
That is exciting. You know, us being sort of the tech-friendly region, trying live streamed on Facebook and YouTube, and of course the podcast on 9 different platforms, and creating a smart speaker skill. I love to see the innovation and embracing technology, but then also that peer sharing, the alliance to alliance communication. There's so much just value in that for learning and collaboration. So creating that space is going to be very, very powerful. I'm excited to see how quick that grows and the changes we can all make together.
Well, we found we learned so much from each other and our experiences, and having a platform where we can share those experiences together and collaborate effectively. I think that's the best training that we can all offer to each other, and it creates that layer of collaboration and communication, and then really puts the victims first. Those that are affected by drug and alcohol abuse, there's an estimate of 9 million kids that are being impacted in the country. It puts them first.
I don't remember who said it, but it's a quote that I never forget. But children are often the first impacted and the last helped. So it's always good to put them first. Let's do something about that.
Right, and I think folks are frustrated by that. And I think the multidisciplinary approach that we certainly have been working with, I think they've expressed that frustration and the benefit of being able to work together to put the kids first.
Absolutely. Absolutely. So there's an important why behind the DEC mission, the children. And for the listeners now, how can they get involved, or what resources do you guys currently have available that they can use to start making a difference in their communities?
We have a really robust website with a wide variety and some depth to the resources that we provide in response to our current COVID response. We've got a series of one-pagers that are specific to each discipline. We early on found and heard from teachers that they needed some support about what to look for and how they would recognize children that were in challenging situations. So we put a one-pager together for that. That goes on our website. So the website's a great one. It's just nationaldec.org. DEC is DEC, so nationaldec.org. We do a monthly e-newsletter that goes out to, about 12,000 individuals. We have a great, robust Facebook page and social media feeds. And then all of our contact information, all the staff contact information is in those different pieces. And if you just need a general email to get a hold of us, info@nationaldec.org will come to all of us.
Perfect. And I will put the links to the social media, the website, and that email address in today's show notes. Great stuff. Is there anything big coming up next year, so 2021, that we can sort of plant the seed about to get folks excited?
2021, there'll be a national DEC convention in Tennessee. So the Tennessee folks are organizing that, and we're providing some support for the national conference. It'll be in Nashville at the Gaylord Hotel. And so a lot of details will be coming out on that shortly. And I think coming out of this time, that'll be a really pivotal national conference. There's going to be a lot for us all to share and unpack what we learned from this experience, So I think it'll be a very pivotal conference for us all to participate in. Other ways that you can engage National DEC are we do provide technical assistance and a variety of trainings. We'll participate in panel discussions. If you're in an area where you don't have a local alliance or a state alliance, we do help with the DEC alliance formation, and we've got a great roadmap and toolkit that is a part of that. We can also, and I think I mentioned panel discussions, but I think the panel discussions have become really valuable, and we can provide some expertise and some support for a panel discussion to help round out the expertise that's shared, and that makes it interactive. And when you can ask questions of a panel that have some experience in this space, again, you learn an awful lot, you build some connections and some collaboration that way as well.
Absolutely. And the engagement and learning from each other goes right back to the mobile app as well, just creating that space for intentional peer sharing and learning from each other, because together we are stronger. I say it all the time, but it is so true. We got to work together to really create a big change in this world.
And that's been one of the pillars of a really effective DEC alliance, has been the ability to recognize what's going on in your area and change responsively. And so we're not an organization that is hung up on this is the way we've always done it. We're an organization that's willing and able to change in response to changing needs.
Very service oriented and always happy to help is the way I see it. You guys are great to work with. All right. Well, this has been a lot of fun, and I look forward to having you back for a few more episodes once we get a little closer to launching the online training or the learning management system. A lot of great things coming, and happy to have you as a partner in our region.
Well, we really appreciate it. We're so excited about the work that the region's doing and the steps that they're taking. We're anxious to learn from your experience and have you share with us. And we definitely look forward to seeing a whole bunch of the folks at the national conference coming up in 2021 as well.
Hopefully we have 7 new local DEC alliances from Kansas coming with us to the conference. Looking forward to it. All right, it's been a pleasure. All right, you have a good one and take care.
Thanks so much, Dave.
That concludes this episode. Thank you all for not only taking time to listen, but your continued work to make our region safe, healthy, and drug-free. If you'd like to know what trainings we have coming up, check out our website at pttcnetwork.org. And remember, prevention is better together. And together, we are stronger.